Hey guys, I'm Sarah Margaret with Home Association Carolina, and today we're going to be talking about mold in houses. So, mold can be very toxic and very dangerous, and it usually thrives in damp and dark conditions and temperatures ranging from 60 to 80 degrees Fahrenheit. Mold can occur in your home, but can also occur in your office, in your car, in your school, or any other place that you spend a lot of time in. It's very important to be able to recognize when you have mold, especially if you're going to be living in your house for many years or you're trying to sell it in the future. You should know mold's potential health effects and to be able to deal with it immediately if you have it. So it is very critical that you're able to identify and get rid of the mold as soon as it starts to develop, because it can have a very detrimental effect on your health. Children, seniors, pregnant women, and people with pre-existing health problems are very vulnerable to the effects of mold. So some people are very sensitive to mold, and some people can develop sensitivities over time. These sensitivities include cough and nasal congestion, coughing, sneezing, and wheezing, sore throat, watering or dry or sore eyes, skin irritation, and headaches. In addition, mold can also cause respiratory issues for people. So certain types of mold produce what is called a mycotoxin, which is a toxic byproduct that can be absorbed by the skin, airways, or intestinal lining. Prolonged exposure to mycotoxins can lead to severe and even deadly illnesses. These can include scarring in the lungs, cancer and pulmonary bleeding, immune and blood disorders, liver and kidney conditions, neurotoxicity, pregnancy conditions, and digestive and heart conditions. So getting rid of this mold in your home is very complex and very difficult. And not only is mold dangerous to be around, it is also very difficult to identify. So professionals use mold remediation equipment, which gets rid of the mold completely and prevents the problem from reoccurring in your home. So people aren't exactly sure how many mold species there are, but estimates range from tens to thousands to hundreds of thousands. Some of these molds aren't very dangerous to human health, but some of them cause chronic health conditions. So harmful molds can be in any of the following classifications, which include allergenic, toxigenic, and pathogenic. So it's important to know when to call a mold remediation team to get rid of the mold in your home, but there's also a few things you can do yourself to get rid of the mold if it's in a small area. The first thing you should do is locate the mold, and you should be able to check all the rooms in your home, including the basement. You should also check under carpeting, flooring, and behind wallpaper or drywall. The next thing you should do is get rid of the moldy materials. You should get rid of the materials that cannot be cleaned or salvaged and dispose of them immediately. This includes wood, drywall, or carpets, or anything else that is growing mold on it. You should use safety gear such as gloves, mask, and goggles before handling anything with mold on it. So the best way to control mold in your home is to prevent moisture from collecting, and there are a few simple steps you can take to do this. You should clean your gutters and check your downspouts and make sure that they're depositing water away from the home. You should check your grating near your foundation and make sure it causes water to run away from the home and not toward it. You should make sure your home is properly ventilated, especially in the basement. You should try and run a fan to promote air circulation. And lastly, you should replace air filters regularly. So there are several signs that can indicate if you have mold in your home. The very first sign, which is pretty obvious, is if you visibly see mold spores, which look like this. The next symptom that you may have is if you have a cold or if you feel like you're battling flu-like symptoms. Another sign could be if you smell a musty or damp-like smell. Another sign is if you feel like you're getting more nosebleeds. If you know that you have a history of flooding in your home, that is a good sign to indicate whether or not you have mold. If you get frequent headaches, or if you struggle breathing or have some respiratory issues, that may be another good sign that you might have mold. If you have places in your house where water or moisture tends to collect, those could be good places where mold could possibly grow in your house. So I hope that you guys learned a little bit more about mold in homes in this video. I'm Sarah Margaret with Home Association Carolina, and I hope that you guys have an amazing rest of your day. Bye!